Hello all, today we will discuss about colitis. I am Mrs. Cover Golden, working as tutor in Triple M College of Nursing. Objectives: at the end of this session, we will be able to see about definition, types of colitis, etiology, pathophysiology, clinical manifestations, diagnostic evaluation, and management. Colitis. Colitis means the inflammation of your colon where the digestive food becomes the poop. Inflammation in your colon can make your poop more urgent, painful, runny, or sometimes bloody. So you can get a temporary colitis from an infection, or some people may also have chronic colitis. It can be as acute or chronic. It is most commonly caused by infection, autoimmune disorders, ischemia, and medications. Moving on to the definition. Colitis is a condition which is characterized by the inflammation of the inner lining of the colon leading to the symptoms like diarrhea and abdominal pain. So the types of colitis, which includes the ulcerative colitis, infectious colitis, ischemic colitis, pseudomembranous colitis, and radiation colitis. So ulcerative colitis, which is a chronic inflammatory bowel disease, it most commonly affects the rectum and colon. It is caused by the ulcers in the mucosa. The symptoms may include bloody diarrhea and urgency in stool. Infectious colitis, it is caused by bacteria, virus, and the other parasite. The most common organisms which causes this infectious colitis are E. coli, Salmonella, and Shigella. Symptoms include diarrhea, fever, and abdominal cramps. Ischemic colitis. It is caused due to the reduced blood flow to the colon. It is common in elderly people. The symptoms include sudden abdominal pain and bloody stools. And pseudomembranous colitis, it is caused by the Clostridium difficile infection. Often it is due to the antibiotic use and leads to severe diarrhea. So etiological causes are infections, autoimmune reactions, reduced blood supply, medications which includes antibiotics and non-steroidal anti-inflammatory drugs, that is the overuse of these medications may also cause colitis, and radiation therapy. Moving on to the pathophysiology. So if you have any infection or if you have any autoimmune reactions also, you may have the reduced blood supply to the colon. So if there is a reduced blood supply to the colon, the medications, if you take in excess, or if there is any radiation therapy also, you may cause colitis. Clinical manifestations. So clinical manifestations include diarrhea, which can be bloody, abdominal pain and cramps, fever or fatigue, weight loss and dehydration. Diagnostic measures: stool examination, colonoscopy, biopsy, CT scan, and blood test which includes CBC, ESR, and C-reactive protein. Moving on to the medical management, antibiotics can be given for infection, anti-inflammatory drugs, corticosteroids, immunosuppressant, IV fluids, and electrolytes. So surgical management, it is indicated only in severe cases. The procedure includes colectomy and ileostomy. Moving on to the medical nursing management, monitor vital signs, maintain fluid balance, administer medications, monitor the stool frequency and characteristics, provide hygienic care. So the dietary management includes, you must take a low fiber diet during the acute phase, high protein diet, avoid spicy and fatty foods, encourage fluid intake. Thank you all.